One of the great things about MOG-EA is that we're working together as a group to address not just individual county challenges, but challenges that affect the whole region.
I think the key regional challenges are pretty similar to the national challenges. They're to do with overuse of medicines and safe use of medicines. Interestingly, however, in Norfolk and Suffolk and Essex, there are some specific issues related to overuse of antidepressants, treatments for psychosis, and treatments for chronic pain use, such as opioids. So they're the sort of things, as a group, we're kind of focusing on. When we sat down as a group, that was obviously the first thing we discussed, what we tried to achieve by meeting monthly. And it was very clear that we want to improve patient care. And we want to do that by making sure that medicines were used optimally. And the only way you can really do that is to use research to inform practice and decisions that we make. So this group is about developing that evidence, sharing evidence, and trying to make sure then when we get into the trusts and all the local areas, medicines are given as best as they possibly can.
I think one of the key things for us is that working across a multitude of organisations, we really managed to get different voices and different opinions from around the region. And actually what's been really interesting to us is that something where we thought wouldn't be a recurring problem, we've discovered other trusts have found exactly the same as us. And then the opposite, when we thought something would be a problem everywhere, we've discovered other trusts have already found solutions that we can import to us.
Having this group and having these experts to go and talk to and people in practice has really revolutionised my whole thinking about my research and actually given me a whole new set of research applications, grants and projects to start working on that I wouldn't have considered in the past. The partnership provides the space for people to share their ideas and share their experience. It's that headspace and that time to sit and think about a problem. By having all those people in the room, we come up with something that's far more likely to be successful and far more likely to improve patient care.
The great thing about having one meeting in your schedule which is completely separate from the rest of your NHS work is it allows your brain to be ticking over the whole time and thinking, what am I going to bring to the group the next time we all meet up? I think we all really relish having that opportunity alongside our day-to-day NHS work to keep thinking about how do we make things better for patients.